Welcome back. This is Midday. Beverly Jordan, Chief Clinical Transformation Officer at Baptist Hospital, is in charge of their new OneCare project. MyChart is a free app for patients with Baptist physicians that allows them easier and more open communication with their physician.
Of course, and she's here to talk about this new app. And you guys just launched this 14 days ago, so this is fresh for folks out there. Kind of explain what folks would use this for.
Right, so on January 1st of 2014, we rang in the new year with our new electronic medical record in 60 of our physician clinics that are part of the Baptist Memorial Healthcare Corporation. On March 11th, we'll take 4 of our hospitals live, and then we'll continue sequential rollouts to get all of our physicians and hospitals on our new electronic medical record. Part of that is the Baptist OneCare MyChart, which is a patient portal. And this is very exciting because one of the things that we need to do across this country is to be more engaged in our care. By having this app on your phone, your iPad, your Android device, your medical information is always with you. How often have you had to go to a doctor's office and they say, "Oh, what medications are you on?" And you say, "Oh, I forgot my list." This way you can pull out your device, you have your medications, your allergies, your problem list. You can pull up growth charts, you can pull up immunization records. So you can help take care of yourself, your children, your aging parents, or anybody else that gives you access to assist.
How long did it take you guys to actually develop this app and get it going?
The application is actually part of our entire electronic medical records. So we partnered with Epic out of Verona, Wisconsin. So it's actually their application, and it's part of our electronic medical record. It took us 15 months. So we signed the contract back in July of 2012. Got our staff together. I have a team of over 150 very talented people that have worked with our clinics and hospitals to get the electronic medical record up and running.
Well, are you guys kind of modeling this after another program somewhere else in the country, or are you the first to develop something like this?
Actually, this is part of the entire electronic health record and meaningful use that the federal government has asked all of us to do. So it's our solution to the patient portal and the electronic medical record for Baptist.
And you said that you guys have quite a few people already signed up for this.
We do. We're very excited. As patients come into our clinics, we're asking them about signing up with MyChart. We have over 2,000 patients currently activated. My husband happens to be one of them.
Okay, good. And you said this is not necessarily, because I was thinking maybe for an emergency situation, but it's not like that. I mean, if you have a kid, if you go into the doctor's office, you can keep track of the growth chart and everything like that.
Correct. It's actually for all situations because it's always with you. If I'm out of town and I have the MyChart app on my phone and I need medical attention, I can pull up my information and give it to a local emergency room or a physician office out of town as well.
Anytime you go electronic, there's always this risk of security, though, and your information getting out there. How have you guys, how can people make sure that this is not going to be a breach of their health records?
Right, so with the vendors, they have to be certified by the federal government. Epic is. And then patient safety and security is always utmost in everything that we do in healthcare, and especially at Baptist. We've made sure that we're compliant so that we can keep people's information safe.
Yeah, and this is pretty easy to download, I'm assuming, just like any other app.
Go to your local app store, download MyChart, and then for additional information for Baptist OneCare, you can go to baptistonecare.org.
Okay, great. Thank you so much for being with us today. Lots of valuable information and kind of puts healthcare at your fingertips.
Absolutely.
All right. Thanks again. We're back in a moment. Stick around.